Hi everyone, this is Nurse Anna from nursestudy.net, where we make nursing concepts simple, clinical, and NCLEX ready. Today we're breaking down chronic obstructive pulmonary disease, or COPD, one of the most common respiratory disorders you'll see in clinicals and a frequent topic on your nursing exams. We'll review what's happening inside the lungs, key signs and symptoms, and then go through 3 full nursing care plans, including related to and as evidenced by statements. After that, we'll finish with 5 NCLEX-style questions and rationales. Let's get started. And don't forget, we have study guides and free audiobooks available in our store. The links are in the description below. Pathophysiology. COPD is a chronic progressive disease that causes airflow limitation in the lungs. It includes 2 main conditions: chronic bronchitis and emphysema. In chronic bronchitis, inflammation of the bronchi leads to excessive mucus production, narrowing of the airways, and difficulty moving air in and out. In emphysema, the alveoli, those tiny air sacs responsible for gas exchange, lose their elasticity and become overstretched. This causes air trapping, CO2 retention, and poor oxygen exchange. Over time, people with COPD have low oxygen levels and high carbon dioxide levels in their blood. Normally, the brain tells us to breathe when there's too much carbon dioxide. But in COPD, the body gets used to those high CO2 levels. Instead, their brain starts using low oxygen as the signal to breathe. So if we give too much oxygen, their brain may think they don't need to breathe as much, and their breathing can slow down. The most common cause of COPD is long-term smoking, but exposure to dust, fumes, or pollution can also contribute. Signs and symptoms. COPD develops slowly, and patients often describe early symptoms as just a smoker's cough. As it progresses, symptoms include chronic cough with sputum production, dyspnea, shortness of breath, especially on exertion, barrel chest from hyperinflation of the lungs, use of accessory muscles for breathing, cyanosis or clubbing of the fingers from chronic hypoxia, prolonged expiratory phase and wheezing, fatigue and weight loss from increased work of breathing. 2 classic presentations are often mentioned: blue bloater, chronic bronchitis, cyanotic, overweight, productive cough, pink puffer, emphysema, thin pursed lip breathing, minimal cough. Lab findings may show elevated hematocrit from chronic hypoxia, respiratory acidosis on ABGs, and low O2 saturation. Nursing care plans. Let's walk through 3 complete nursing diagnoses, including related to and as evidenced by statements, plus interventions and expected outcomes. Nursing diagnosis. Number 1, ineffective airway clearance, related to excess mucus production and airway inflammation, as evidenced by adventitious breath sounds, wheezing, thick sputum, and ineffective cough. Nursing interventions. Encourage coughing and deep breathing exercises. Use huff coughing techniques to clear mucus. Administer prescribed bronchodilators and expectorants to improve airflow and loosen secretions. Increase fluid intake, unless contraindicated, to thin secretions. Position patient in high Fowler's or tripod position to maximize lung expansion. Use humidified oxygen as prescribed to ease breathing. Rationale: promotes airway patency, mobilizes secretions, and optimizes gas exchange. Expected outcome: patient demonstrates effective cough, clear lung sounds, and oxygen saturation greater than or equal to 92%. Nursing diagnosis number 2, impaired gas exchange, related to alveolar destruction and air trapping in the lungs, as evidenced by dyspnea, tachypnea, use of accessory muscles, SpO2 less than 90%, and ABG showing elevated CO2. Nursing interventions: monitor respiratory rate, depth, and effort every 2 to 4 hours. Administer low-flow oxygen, 1 to 2 liters per minute, via nasal cannula. Avoid high flow to prevent respiratory depression. Encourage pursed lip and diaphragmatic breathing to promote exhalation and prevent air trapping. Provide small frequent rest periods between activities to conserve energy. Assess for mental status changes, an early sign of hypoxia or CO2 retention. Rationale: maintains adequate oxygenation and minimizes CO2 buildup. Expected outcome: patient maintains SpO2 greater than or equal to 90% and demonstrates improved breathing pattern without distress. Nursing diagnosis. Number 3, imbalanced nutrition, less than body requirements, related to increased energy expenditure during breathing and decreased appetite, as evidenced by unintentional weight loss, muscle wasting, and fatigue. Nursing interventions: provide small, frequent, high-calorie, high-protein meals. Offer meals after bronchodilator therapy when breathing is easier. Limit gas-forming foods that may cause abdominal distension and impair diaphragmatic movement. Encourage adequate hydration to thin mucus. Consult a dietitian for nutritional supplementation as needed. Rationale: ensures adequate calorie and protein intake for healing and energy needs. Expected outcome: patient maintains stable weight and reports improved appetite and energy levels. Complications and nursing priorities. Complications of COPD include acute exacerbation triggered by infection or environmental exposure. Core pulmonale, right-sided heart failure due to pulmonary hypertension. Respiratory failure from severe carbon dioxide retention. Priority nursing actions: monitor for worsening dyspnea, decreased SpO2, or mental confusion. Early signs of CO2 narcosis. Administer bronchodilators, corticosteroids, and antibiotics as prescribed. Maintain low-flow oxygen and avoid over-oxygenation. Educate on smoking cessation and avoiding respiratory irritants. Patient teaching points: avoid smoking or exposure to secondhand smoke. Receive annual influenza and pneumococcal vaccines. Use pursed lip breathing to control dyspnea. Recognize early signs of infection, increased sputum or fever, and seek prompt care. Conserve energy with clustered care and rest between tasks. Nursing practice questions. Let's test your understanding with 5 NCLEX-style questions. Question 1. The nurse is caring for a patient with COPD who has a new oxygen prescription for 4 liters per minute via nasal cannula. Which action should the nurse take? A. Administer oxygen as ordered. B. Lower the flow rate to 2 liters per minute and notify the provider. C. Encourage deep breathing and coughing only. D. Discontinue oxygen therapy immediately. Correct answer: B. Rationale: COPD patients rely on a hypoxic drive to breathe. Oxygen above 2 liters per minute can suppress respirations and lead to respiratory failure. Question 2. Which nursing action is most appropriate during a COPD exacerbation? A. Encourage a high-fat diet. B. Increase fluid intake to 2 liters per day. C. Maintain the patient in a supine position. D. Administer antitussives to suppress coughing. Correct answer: B. Rationale: fluids help thin secretions and improve airway clearance. Question 3. The nurse observes a COPD patient using pursed lip breathing. What is the purpose of this technique? A. To increase oxygen intake. B. To prevent airway collapse during exhalation. C. To strengthen intercostal muscles. D. To enhance diaphragmatic movement only. Correct answer: B. Rationale: pursed lip breathing prolongs exhalation and prevents airway collapse, promoting better gas exchange. Question 4. Which laboratory finding is expected in a patient with chronic COPD? A. Low hematocrit. B. Decreased PaCO2. C. Elevated hematocrit. D. Increased pH. Correct answer. C. Rationale. Chronic hypoxia stimulates erythropoiesis, leading to polycythemia, elevated hematocrit. Question 5. Which finding indicates improvement in a COPD patient's condition? A. Respiratory rate of 30 per minute. B. SpO2 increased from 86% to 92%. C. Use of accessory muscles during rest. D. Increased confusion and drowsiness. Correct answer. B. Rationale. An SpO2 of 92% reflects improved oxygenation. Other options indicate deterioration. Quick summary. Let's review the top 3 NCLEX takeaways for COPD. 1. Low flow oxygen only, 1 to 2 liters per minute via nasal cannula. 2. Pursed lip and diaphragmatic breathing improve ventilation. 3. Nursing care plans should address airway clearance, gas exchange, and nutrition. Always include related to and as evidenced by if this is how your nursing instructor is teaching. Thanks for watching, and don't forget to subscribe for more nursing care plan breakdowns and NCLEX practice exams. Visit nursestudy.net for detailed study guides and nursing care plans, along with interventions and rationales. You've got this. Keep studying smart, and I'll see you in the next video.